Hi, welcome back. Adam Rosen here. Thanks for tuning in. Today, I want to talk to you about a question that a lot of patients have, and many doctors still don't really have the answer to, and that is if you've had a joint replacement surgery, do you need to take antibiotics when you go to the dentist? So, this has been very confusing and complicated because for many years it was felt that the risk was there and that if you had a knee or hip replacement, you should take antibiotics for the rest of your life when you went to the dentist. Um, and slowly, in America, many people believe that wasn't necessary, and probably 2 years was sufficient. And now, even that is coming into question as to whether or not it's even necessary at all. So, in the UK, from what I understand, they do not typically prescribe antibiotics. And there was a very recent study, and I couldn't find it. It was a year or two ago that looked at 30 some thousand, so 32 or 33,000 patients without antibiotics and weren't able to show an infection relation between the dentist and an infection in the knee. What has confused a lot of dentists and American surgeons and patients is that over the past few years, a lot of studies with recommendations have come out. So in 2012, the American Academy of Orthopedic Surgery and the American Dental Association, so this is a decade ago, came out with these clinical practice guidelines and said there was limited evidence to show that antibiotics were necessary. But the studies they looked at were small, and even a follow-up study, I mean, there's studies with 300 patients, 17 patients with infections, 160 patients. There was one study with a few thousand patients, but it was from 1970. So there's nothing recent that's very good. And when we talk about studying something where the risk is 1% or less, to reach statistical significance, you need a very large number of patients in the study to really prove if there's a difference between group A and group B. And to this date, as far as I know, no one's done that study because it would take a lot of time and energy and money and patience to answer that question perfectly. So for many patients and many doctors, what we have routinely done is said if you have a knee replacement, hip replacement, when you go to the dentist, take these antibiotics an hour before, which would be typically 2 grams of amoxicillin, or if you were allergic, 600 milligrams of clindamycin. More recently, some guidelines have come out from the Hip and Knee Society and from the Academy, which has this algorithm that you see here and looks at, is the dental procedure invasive or not invasive? What is a patient's health status? And it goes into what is the time from the joint replacement. So where does that leave you and me? The answer, again, is I don't know. I like to give you an answer, and this I'm just giving you information. I really believe, and I kind of follow with the guidelines, that the best thing is a discussion with your surgeon and your dentist. I do find that many dentists, when I talk to them, they're under the belief that you don't need antibiotics, but they don't really know what happens. So in my career, the past 15 plus years, I've seen, I think, 3 patients from what I can recall that have had an infection after a dental procedure. Not that the dentist did anything wrong, but it is mouth bacteria that we see in the knee. And that will require 1 or more operations, 6 or 8 weeks of IV antibiotics, sometimes followed by a longer course of oral antibiotics. So it's a big deal. It's not just 7 days worth of antibiotic pills. And when many dentists hear that, they're a little bit more cautious. So we do know that patients that are at high risk are the group of people that probably should be placed on antibiotics. So these would be diabetics, transplant patients, rheumatoid arthritis and other autoimmune diseases, history of a prior total joint infection, cancer, AIDS, things that suppress your body's own immunity. It is important, many people believe, and I believe, although some of the studies haven't really shown that they have evidence to support this, but good dental hygiene. The most recent guidelines from the Canadians in 2022 did suggest this, that good oral hygiene, especially before the surgery, is important. So floss your teeth and brush your teeth regularly, get routine dental checkups, and if you're having pain, get it checked out. Don't let it sit and fester. But whether or not you need antibiotics, the question is still undecided. We used to, where I work as a group, prescribe mostly for life. More recently, years ago, we had decided for 2 years. But even now, the question is, should we even extend it for 2 years? Should we do 1 year? And should we do none at all? So this really comes down to a patient by patient discussion and basis on what is your feelings and concerns, what's the doctor's concerned, what is your health status, what is your oral hygiene like? Have you had good oral hygiene, or have you had multiple problems and questions? Have you ever had a joint replacement infection in some other part of your body? And that informed consent decision process is what helps. So in the future, hopefully we have an answer that says, yes, you do, you don't, and if you do, it's for this long from your surgery. But in the meantime, it is still up in the air, and this is a thing that's debated in our world on a regular basis, and hopefully we'll have that big study which will answer the question for all of us. But in the meantime, floss, brush, go to the dentist, and if you've had a joint replacement and are going to the dentist, talk to your surgeon and talk to your dentist and make a decision between the three of you as to what would be best and safest for you. So thanks again for watching. If you haven't already subscribed, please subscribe below. And if you like this information, click the thumbs up button. It helps people like you find this information on these videos. Until next time, I'm Adam Rosen. Thanks for watching. Stay safe.